afternoon, everyone. I'd like to call to order this October meeting of the Delaware County Jail Oversight Board. Can we start with a Pledge of Allegiance? Please rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. In addition to who we have in person, we have virtually, we have Sheriff Sanders, we have Judge Whalen, Judge Brennan, and the Controller Joanne Phillips, as well as our Controller Shelley Smith. I would like to announce that we did have an executive session last week in advance of this meeting to cover matters of public safety as well as contractual and employee matters. The first item on the agenda for today is public comment. And so if there's anyone from the public who would like to address any matters on the agenda, please come forth at this time. Seeing none or hearing none, we'll move on to an approval of the September meeting minutes. Is there a motion to approve?
I make a motion to approve the September 2022 Jail Oversight Board meeting minutes.
Second.
Motion and a second. Any questions or comments on the minutes? All in favor? Aye.
Aye. Aye.
Aye.
Any opposed? The ayes have it. Next is an approval of the September reports. Is there a motion to approve the reports?
I'll make the motion.
Make a motion that we approve the September reports.
Thank you, Sheriff Sanders. Is there a second?
I'll second the motion.
Thank you, Your Honor. Motion is second. Any questions or comments? Hearing none, all in favor? Aye.
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 Any opposed? The ayes have it. We do have on the agenda the 2023 budget proposal. Is that something you'd like to address, Warden?
Thank you very much. Myself and Deputy Warden Mastrati will be speaking to the proposal that we have. Sean, would you be able to cue this up for us? And as previously discussed, the intention of this presentation is a proposal for the funds for the 2023 fiscal year. It's very important, we think, to break the budget down, as this previously was maybe not discussed to this depth. While GEO was the contracted employee in Delaware County to do the management of the correctional facility, it's unlikely that there was a level of transparency or awareness of how the dollars were being allocated or spent within the budget. And we wanted to ensure that we provided that information not only to the board, but to the Delaware County public at large as well. So you will see a lot of breakdowns within this presentation, and we will be happy to elaborate. This is intended to be interactive, so if board members do have questions on particular slides, I think it would likely be best to reference those slides. So please do not hesitate to interrupt either myself or Deputy Warden Mastrati as we are progressing through the presentation. As you can see, we've included the vision statement. This is something that has been discussed with the board in the past. Ultimately, George W. Hill serves to increase public safety in Delaware County, and we do that in a number of different ways. I've also included the core values of the institution, which is how we enact the vision and mission within the facility. We've talked about this in the past, that we as an agency serve as a conduit for the criminal justice system, as well as providing health services to those that are incarcerated. And ultimately, the goal of our agency is not only to preserve the health and safety of those entrusted in our care, but to essentially restore or establish that health and safety prior to their reintegration into the community. We have a number of goals and objectives that we hope this budget proposal will allow us to meet. And some of the primary goals are to bolster staff initiatives, to enhance consistency within institutional practices, decrease critical incidences, increase longevity and investment of employees, decrease rates of attrition and overall vacancies, and become a premier employer within the Commonwealth. And you can see we've broken down that primary goal in the steps of action in which we intend to complete that mission. One of those is creating and fostering a culture of diversity within the institution that enables recruitment to be focused on our employee target population, to make sure that we're meeting their needs and that they are able to effectively manage within their duties and functions within the institution. We are seeking continuously motivated employees who want to enact our core institutional values, missions, and goals. We have a number of capital budget projects, some of which you will recall Danielle Floyd, who is the Director of Facilities Management, had presented to the board several months ago. We need to seek innovative solutions to institutional capital budget projects while identifying sustainable and permanent solutions. And one of those examples is the domestic hot water solutions. We did not want to simply replace in kind the system that was in current existence within the institution. We wanted to identify a more efficient means of providing hot water to the incarcerated population while not repeating some of the learned mistakes from the system that we presently have. We will continue to collaborate with county departments and stakeholders for cost savings and increased efficiencies and identify stages of planning for future projects. I would like to say that the budget proposal that you had a preview from facilities is comprehensive and that we won't be seeking further investment financially into the institution, but that is not the case. So you can see some additional breakdowns of areas of opportunity that we have identified within the facility needs assessment that we continuously do and produce on site with subject matter experts, one of which was our interim deputy warden of security, who certainly identified some areas of opportunity. We've also utilized the expertise of Dr. Metzner, as well as Michael Young, who is an HR consultant, who has been predominantly working with employees' health and wellness initiatives that we've also previously discussed. We certainly want to enhance current programs in existence and increase program availability of best practices for reintegration services, ensuring quantitative measurables are identified and tracked to monitor progress. So we're looking at IT software that might help us, manage the data to ensure the efficacy of the programs that are being established. We may also be identifying additional personnel. Some of the proposed personnel within the budget for 2023 includes a data analyst that will assist us in ensuring that these initiatives are effective and an appropriate expenditure within the budget. We certainly want to continue to support the infrastructure of programs that are currently in existence, and I believe have already demonstrated, and that will be a later presentation within the Deputy Warden of Programs and Support, the expansion of programs within the institution, one of which notably is medication-assisted treatment. But we do have a number of others that have been worked on within the facility over the last couple of months, including the Inside Out program and our partnership with Penn State Brandywine that we're very excited about. We are absolutely prioritizing a number of different initiatives, but our focus will be maintained with our staffing. So you can see the highlighted bullets that are consistent with our values. So we will be increasing a lot of the standards within the institution by investing in our training programs, which we think will positively impact our retention rates of our staff, as well as the outcomes for those that are incarcerated within our care. All of this being completed through the lens of efficiency, sustainability, accountability, as well as transparency within the institution. This is an important slide, I think, in the breakdown of costs. So you can see in 2022, if you'll look at that table in the lower left quadrant of this slide, There was $1 amount that was identified, and as an initiative to increase the transparency, we worked with the Controller's Office as well as Budget to make sure that we have these separate, we call them workbooks, to establish the different departments that are accounting for the expenditures within our budget. So you will see that we have divided costs out within administration, maintenance, programs, records, security, health services, and food services. Our two contracted services are those at the bottom, health services and food services. And you will see that we are projecting a deficit, meaning less expense, from the 2022 to 2023 year by $1.7 million. So we will not be sacrificing the integrity of services, but do believe that we will effectively manage this budget at less cost to Delaware County. And this is including a large pay increase for all of the employees within George W. Hill Correctional Facility. On this slide, you can see that we have broken down further the workbook that was on the previous page. So you can see that the large volume of our departmental costs does go to security, staff, personnel, and initiatives. The second highest cost is our administration. This is comprehensive of health benefits, and that is an estimated or projected cost based on the current available plans as well as historical benefits that had been previously offered. This is, however, a projection, as this is subject to negotiation. So it is possible that this amount will change in the future. I wanted to make sure that that was known by the board, but we wanted to ensure that we were projecting what we believe to be a reasonable breakdown in costs for each of these departments. Capital costs, as we have discussed, have been submitted through the facilities capital improvement plan. I've asked Deputy Warden Mastrati to speak a little bit towards revenue and capital within this project.
Good afternoon. So you can see there's a breakdown of where all our revenue sources come from. It's the booking fees, the inmate telephone revenue, vending commissions, Social Security, and room and board costs. As you can see, we're really right in line with 2022 as far as what we are projecting. The only real variance is there was a miscellaneous revenue that we have decreased. We also have the increase in revenue from the booking fee as it was not imposed in 2022. As far as capital projects go, like the warden had stated, the majority of our capital projects are going to be done through Public Works. We have some small things like the front gate replacement and small projects that we will be doing. And they are broken down into those areas for computers, buildings, furniture and fixtures, and equipment that'll be needed.
Hi, I have a question. What is the miscellaneous revenue that's no longer available?
That was in 2022. I really, unfortunately, can't speak to that. It was in the 2022 budget, and I could not identify it, and the revenue did not come in as far as in 2022.
To be clear, this is 2022 budget, right? This is an actual?
That's 2022 budget, but in actual, the $40,000 in miscellaneous revenue did not occur
But for
as
example,
of to
the
date.
booking fees may not have been budgeted, but there have been at least a couple of months' worth
Correct.
of booking fees collected.
Correct.
Okay.
Right now, we're up to approximately $138,000 in booking fees.
When we saw earlier the dedication of funds towards different departments and staff, I wanted to make sure that we highlighted the organizational chart. Now, this is not representative of every single job title or class within the facility, but does at a very high level speak to the departments. This is a proposed organizational chart. There have been some additional positions within this. One is a chief deputy warden position that would be directly overseen overseeing the deputy wardens and director of records. You can see the departments that have been added within, so there is full representation. Our deputy wardens do manage a lot of different direct reports within the institution, and we do have a large volume of staff within the facility that makes sure that the day-to-day operations continue. Within each of those departments, we do see expanded positions. So those are not necessarily represented within this, but we have designated proposed initiatives within all of the departments, or at least within, I should say, security, administration and operations, and programs and support, to make sure that we can increase the level of services that are provided in the facility. So looking ahead, sometimes I find it hard to believe that we've been in this for 6 months. So last week, we celebrated 6 months within the transition from the contracted provider to county management. Throughout that 6 months, it has been a continuous evolution in which we are evaluating our efforts and initiatives. We continue to put in qualitative measures or quantitative measures to help us do that. We have been engaging in exit interviews. We've been speaking with staff as frequently as possible to gain feedback, and that has assisted in our ability to evaluate a number of the different operational strategies that we've had within the institution. We have engaged in some job and position title changes, as well as reporting structures, to make sure that the decisions that we make have the most positive outcomes and effect on our incarcerated population as well as our employees. We continue to welcome needs assessments, vulnerability assessments. We have been engaging, I believe, very openly in our capacity to evaluate where we can improve, and we have been leading upon our stakeholders within the criminal justice system, as well as the Public Works Department, to make sure that we are making the most informed decisions possible, because we do recognize the responsibility that we have to county dollars in the decisions that we make. We aim to lead initiatives in county corrections. We are very excited about a lot of the initiatives that the board has already provided support that will allow opportunities for revenue sourcing in the future. We hope to be a training facility for other correctional entities within the area or the Commonwealth of Pennsylvania, so that we can support other agencies that have been struggling. And we endeavor to support our staff and enhance and develop longevity within the agency. There are so many benefits to retaining staff and increasing consistency within the institution. So that is, for at least the budget portion, our presentation to the Oversight Board. And I'm not certain if there are any other comments or questions, but I would be happy to receive those at this time.
Thank you, Warden. Are there questions or comments from board members?
I just want to go on to that revenue that seems to be unidentified and missing. Are we concerned about that?
Which
And obviously, well, the miscellaneous revenue of $40,000 that was listed in the prior year's budget, and according to our executives now, that wasn't ever received. So I guess I'm looking to Mr. Lazarus. I'm not sure where I'm looking, because obviously the folks at the podium were not around in 2022.
Yeah, I mean, personally, I think it's a good question. I think we should find out what it is. In the overall scheme of a budget that's for 52 million or so, $40,000 is a pretty small amount of money. But I agree that we should always understand, every line item, so perhaps we can get some follow-up on what that is.
I can dig into the previous warden's paperwork and try to identify what that was and send it to you guys.
Sure. Is that?
Thanks. Oh, sure.
I don't know if it's important to clarify, but the revenue that's generated from our facility does go to the county general fund. So though it could offset our budget, it is going to a different department. But we will, as Deputy Warden Mistrati identified, look into what that source was to be.
Warden, remind us what revenue goes into the inmate welfare fund versus the general fund.
commissary commissions. The commissions from the commissary,
Is that the only?
that is the only source.
That's the only source, okay. One question I had was just what the underlying assumption was with regard to prison population that's baked into the 2023 budget. Do you have any guidance for us there?
I did base everything on a population between up to 1450 for food services and healthcare services.
Up to 1450. And today, our census is approximately what?
1329?
1329. Realizing, however, that in years past, it has been as high as 1800
Correct.
plus. So while I don't personally have any expectation that we're going to, in the near term or even medium term, go back to such levels, it seems like a fairly good conservative assumption to put something higher than where we currently are. Any other comments or questions on the proposed budget from board members?
Yeah, I'd just like to make one comment just in terms of the miscellaneous revenue. I'm not sure what that was intended to cover. I'm sure we can find out. But I wanted to say that in prior years, really beginning from 2018 on, just so people know the historic context of that, the revenue for the prison was never even reported. It was just netted off the GEO bill. So the county's made really improvements on tracking that revenue. And I think that'll give us an opportunity to look for other areas where revenue could come in. I mean, hopefully at some point in the future that, perhaps there will be grants or other things that will benefit the prison. So, I appreciate the line item, notations here, so.
One other question I have, in years past and in this year, there have been fees imposed on third-party vendors, GEO and now, other subcontractors. Is there any assumption baked into 2023 for such fees, or is that assumed at zero?
It's assumed zero.
Okay.
So if any fees were to occur, it would be an offset.
Yeah, and look, ideally, it is
The goal
zero
is-
because we're getting fully compliant contracts, but
Correct.
good to understand. Personally, I think I appreciate the underlying assumptions that you've baked into this in terms of what our goals are and our values are for running this jail. I appreciate the extra investments that are baked into this budget as it relates to services and support for inmates and for our employees. The fact that we're realizing the fact that we work in an inflationary environment, one that's very challenging from a hiring perspective, and it sounds like we've baked that into our assumptions for 2023, which I think is something we need to do. I have nothing further, but I appreciate the presentation. All right, Warden, we'll move into the General Warden's report.
Wonderful. So while Sean is queuing that up as well, last month we had some public comments, and I wanted to provide some response. I was very thankful that my team quickly reminded me immediately following the meeting that it would be good to get this information out there. So we had discussion related to AA and NA, as well as recovery-based services within the institution, in addition to the in-person services that we are providing with our medication-assisted treatment through our partnership with WellPath. We have the big book located in the free section on the tablet, so that is accessible by any person within the population. Edovo, which is the education platform, which is also free to the population, has 129 recovery courses available, which includes Spanish and English versions of the Steps of AA Explained, 12 Steps and 12 Traditions, Alcoholics Anonymous. And I do have a listing if the board would like to receive those 129 courses. We can produce that at any time. I also wanted to acknowledge and thank Delco CPR. They did come to the facility for a visit on September 12th. And wanted to make sure that I publicly announced, though the board has already received notification, that we will be hosting the Pennsylvania Department of Corrections for our Title 37, Chapter 95, which applies to correctional agencies, inspection on October 27th. So we will not have a full finalized report for the next Jail Oversight Board meeting, but we may be able to provide an initial findings during the next month's meeting. If not, we will provide those findings in December. I will be, I think, retitling this slide as long as there's no opposition from the board to infectious disease updates in the future, because we have, you know, a number of different transmission issues and concerns. We are also entering flu season, so it may be good for us to report on a number of different items. But in terms of COVID-19, Delaware County remains in the medium transmission rate. I did speak with the director of the health department, Director Lyon, today, who confirmed that we do still have a high positivity testing rate. We're around 11% in Delaware County. So we are continuing to follow the recommendations based on the CDC. In the month of September, and that's a typo, it says August, but in September, we tested 140 incarcerated persons using PCR tests. 12 of the 140 were diagnosed as positive for COVID-19. We did also report last month that we had placed one of our female housing units on a quarantine status. That was lifted. We did not have any negative outcomes, and we presently have 0 positive cases in the institution currently. 563, or 43.8%, of our incarcerated population is vaccinated. That is an increase from 40% last month. I also included, because I thought that it was helpful for us to see the last year, and this is something that is tracked within the New York Times. Anybody can Google it, so I did include, to give credit to the source of the information, the Pennsylvania cases, specifically Delaware County. You can see that we have been trending towards the fewer over the last several weeks. We do have one confirmed case of monkeypox within the institution. The individual was tested, and the specimen was sent to the Bureau of Labs, in which we received the results to have a confirmation case. We have been partnering both with Delaware County Health Department and the Pennsylvania Department of Health to ensure that we are engaging in all mitigation protocols. We do have several individuals presently under observation and isolation. We do have one suspected case. It was somebody who was just tested today, and we do anticipate having the results from the Bureau of Labs within 48 to 72 hours. It is presently believed, should this case, the suspected individual, be positive, that this was a result of community transmission based on the incubation time period. At this point, I'm advised by the health department that there is a very low community transmission rate within Delaware County, that persons should educate themselves. There are vaccines that are available, and Delaware County Health Department does have them. They do offer those prophylactically, and they will engage in treatment should you require that. And they wanted, I was encouraged to educate the public that this is transmitted through prolonged skin-to-skin contact, and that is presently what we're working with in the institution. We are exploring opportunities for vaccination with the Delaware County Health Department partnering to accomplish that in the institution. This could be offered to employees and the incarcerated population. We are learning more about whether or not, if somebody was presumed to be exposed, should we wait any certain time period before offering the vaccine? And as we're getting that information from the experts, we will be, of course, advising the board and then taking action to provide that treatment option or intervention option for our staff and incarcerated individuals. Today's current population is 1,329 incarcerated persons. This is a decrease of 3 from last month's meeting. Our weekender program remains suspended, but it will be reenacted later this month.
I'm sorry, just it says on here 1321, but I think you're saying 1329. What is the?
Deputy Warden had said 1329. It was 1321 was this morning's count. She may have referenced this afternoon's count. I had completed the slides earlier today.
No problem, just want to clarify.
So we could both be correct depending on the timing. Last month, our total commitments was 557, which is a decrease from the previous. We had 583 discharges. We have continued to provide full recreation on each of the housing units, general population housing units, throughout the duration of September. We did have a few shifts, never a full day, in which the population would have been remaining within their cells. So I thought that it was important that we continue to be transparent on those reports. There are some times when security needs will take precedence, in which we may decrease the amount of recreation that is offered. But just wanted to note and clarify that you'll notice these are by shift. So there was not a single day in the month of September where a housing unit had been locked in for the entirety of the day. There were no major incidences to report, and we identified serious contraband 13 times in the month of September. I've included an image of Class 0822B that graduated on Friday, October 7th, and you'll see the Honorable Judge Barry Dozer also pictured in that. He was present for the graduation and actually conducted our very first swearing-in ceremony. We have intentions of honoring all of our staff and law enforcement members with swearing-in ceremonies. This was the first of many, and it was very exciting to see these individuals take the oath and commit themselves to their service. We have had 14 classes complete the Cadet Basic Training Academy. We had a class that recently began on September 26th and another that began just yesterday on October 10th. We have a full class to start on October 24th. We have added in another class on November 14th to ensure that we do not miss people who are interested in working for our facility in the county, and have our final class scheduled for November 28th of this year. So I was very excited to be able to show the board the picture of the most recent class and let you know about that institutional moment that we had. Very exciting. As my monthly plug, we are still seeking motivated employees that want to work in our institution. We do have, we have had the sergeant position posted. We have several offers that have been extended, and I do believe we only have one remaining vacancy at the rank of sergeant. But we are actively seeking correctional officers. WellPath is still seeking to fill positions, predominantly RNs, though they do have an LPN vacancy for night shift full-time, and a nurse practitioner vacancy. We did add some additional positions within to make sure that we're meeting all of our access to care projections and needs. They will be having an in-person job fair on October 20th. So if anybody in the healthcare industry is interested, please do seek out WellPath's information and apply. We've spoken a lot about Employee of the Month, and it's one of my favorite presentations during the board meeting. We did change the way that we provide this because we are receiving a ton of very appropriate and well worth it nominations. And I'm very thankful because I'm not receiving these just from management staff. I've had several employees who have submitted on their own recommendations and nominations for Employee of the Month. So we have started to expand this to honor 2 employees, who do not hold supervisory positions, as well as a supervisor each month. Several of our supervisors have taken strong leadership initiatives, and we do think that it's very important to acknowledge that. It's important to acknowledge that you're a leader no matter what your rank or title is. And we do have a large volume of employees who consistently demonstrate their commitment to a positive future and challenging themselves each day to be better than the day before. This month, I'd like to celebrate, acknowledge, and congratulate that Caitlin May, who is an administrative assistant and WellPath, not self-described, but as her nominators presented, she is the heartbeat of that department and consistently knows everything that needs done and is very aware of the patient needs, particularly those that are most vulnerable. Booking clerk, Caitlin Murray. She single-handedly helped book over 20 individuals during one shift, providing support to the security or custody staff that she was partnering with and increasing efficiencies in the intake department to get individuals out of that unit and to a housing unit as quickly as possible. And Lieutenant Kerry Platt, he is one of our second shift supervisors who has taken on several different initiatives on his own within the institution to ensure that all individuals have mattresses, that there is accountability of resources and tools, and ensured that individuals were receiving the suicide prevention blankets. We've also acknowledged the previous month of employees, and I anticipate that next month we'll probably have to break this down into 2 slides just so that we don't forget those hardworking employees. Earlier this month, myself and Deputy Warden Mastrati had the pleasure and honor of representing Delaware County at the Pennsylvania County Corrections Association Conference that was held in Harrisburg, or Dauphin County. Later this month, Deputy Warden Daley Falley will participate in the fall conference for the Pennsylvania Prison Wardens Association. And as you can see, it's extraordinarily important that we remain active members of these organizations. There's a large amount of information sharing and discussions going on. Delaware County is definitely at the top of most conversations. Many of our colleagues have been looking towards the transitions within this county and have expressed their support and encouragement of what they've been able to see. So we will continue engaging in that. You can see that 56 county staff representing 22 counties, 39 Commonwealth staff from 17 facilities, and 14 retired members are expected in attendance. And I look forward to Deputy Falley representing our county and agency. This will take place in Washington, Pennsylvania. As Deputy Mastrati alluded to earlier, we do have some of our cost recovery items in which we've updated. In September, you can see the volume that we accrued, the deposit to the Inmate Welfare Fund at the bottom line. So we did provide not comprehensive information before. So the 2 streams that go into the Inmate Welfare Fund are the commission from commissary, and then anybody who has less than $1 on their account, we are taking that instead of issuing them a check and placing that into the Inmate Welfare Fund as we had previously voted on within this meeting. You can see the year-to-date totals as well for cost recovery items. And then,
sorry, can you just go back to that
Sure.
slide for one moment? Deposited to Inmate Welfare Fund, can you put the number in context? So $5.71 in September?
yes.
That's the total amount of commissions?
No, so the commissions from
see.
commissary were not included.
Got it. This is just the under $1 amounts?
Yes.
Okay.
So we've included it on this slide only because this was an item that we voted on within the Jail Oversight Board. So we wanted to ensure that we were providing updates on that. You can see it's nominal, but it's important that we acknowledge that we have been able to add a very small amount, 2430 year to date, from those that were leaving our facility with less than $1 on their account.
And the other fees that are on, the other costs recovered go into the general fund?
Yes.
Okay. All right, thank you.
And we can break that out in the future if that's helpful. We wanted to ensure that we provided an update on our contracted agreements. So we do have Aramark and Viapath. We did not provide in specific WellPath because we will be discussing their engagement in MAT later within the Deputy Warden report. But within commissary, we've had a number of different discussions related to the menu. We have updated this with the vendor. We anticipate communicating this to the population within the next week so that they can begin ordering some expanded items. We will also be adding the option of care packages that friends and family are able to order. We anticipate being able to do this quarterly. So they will be seasonal items that are not available on commissary. These can range from $20 to $75 gift bags that family and friends can order on behalf of the incarcerated person, and then they will receive that in addition to whatever they might be ordering on commissary. We have also expanded the level of feminine hygiene products that are available within the institution. So those are added onto commissary. Normally, I wouldn't make that known, but I wanted to ensure that the board was aware that we are only adding that onto the commissary in the addition that the individual wants to purchase more to have on their person. We will be providing all feminine hygiene products and are presently providing those at no cost to the incarcerated person. But we also provide toothpaste, shampoo, to those that might be indigent. Those items too are available on commissary. So I didn't want people to believe that they could only purchase these items, but wanted to make sure that we offered that clarification during the meeting. We have also, though this doesn't necessarily fit within the Aramark contract, we were having challenges getting money placed on the accounts of juveniles. And there was a challenge with that because the offenders cannot have their identities known. That would be a violation of CREA and certainly wouldn't be protective of the juvenile. So we were able to work with Viapath to make sure that persons can do an online account deposit very similarly to how they would be able to with the adult offenders while still protecting the identity of the juvenile. So that change has also been enacted so we have less barriers for our juvenile population. This special meal provided to the population in October was served on October 5th, and it included turkey bacon cheese sandwich with tater tots, tossed salad, and chocolate cake. And for gluten-free individuals, they were served a cheeseburger without bread and duplex cookie, and vegetarians received grilled cheese. So these are, we had talked to Aramark about doing something different and special at least once a month. Last month, they had personal pizzas that were available. So wanted to make sure that that information was also known. We are still working with the vendor to finalize menus. We've been receiving a large amount of feedback from the incarcerated population in terms of the diet and what is available, and increasing the fruit and vegetable availability within these diets is extremely important. We're hoping to be able to finalize those menus with Aramark very soon. And with that, that concludes my report, though I would be happy to entertain any questions before we move on to other agenda items.
Are there questions or comments from board members? Thank you, Warden. I also want to give my thanks to Judge Dozer for coming out and honoring our new cadets. Otherwise, great report.
Wonderful. Thank you so much. At this time, I would like to invite Michael Resnick to the podium.
Yeah, so I'm not sure. So we have on the agenda for today, the next item being a consideration of the booking fee. Mr. Resnick, I appreciate your availability if there are members of the board who would like to ask questions of you. But this is a topic that, as board members, and I think the public might remember, we visited last June. There had been a suspension of the booking fee during the course of COVID. The view, and I supported this at the time, was that we didn't really have grounds to continue the suspension, which was temporary, while visitations had ceased to be suspended. But I did say at the time that I wanted this board to consider the booking fee at an appropriate time, and I think now is as good a time as any. I have, and I want this to be a conversation amongst board members. I will share my own personal views to kick things off, which is that, I think the booking fee, I do appreciate that some may view, from a fairness perspective, the idea of charging those who are booked, those who began their incarceration at George W. Hill, a fee, and currently we charge $100, which is on the high side. It's roughly twice what the average fee is that's charged in the state of Pennsylvania. And there are, I think it's 35 out of 62 within the state charge some fee, whereas 25 do not at all, including Philadelphia and Bucks County. I think the argument that people have is you are having those who are placing a burden on the taxpayer, you're charging them for the costs of booking. While I get that perspective, I would also argue that the removal of one's personal freedoms is in and of itself a significant burden to place on a person. And my personal view is that from a pragmatic perspective, we ought to be laser focused on recidivism. And for those who fall into the criminal justice system, doing our best to put them in a position to get their feet back under them and stay out of prison once they are done their time at George W. Hill. And imposing a financial burden upon them really shoots us in the foot in that matter. It's when someone is leaving jail and they have a lot to put back in getting their life back together, walking around with a burden, a financial burden that hangs over their heads and continues to increase every time they come back. That $100 fee sits there, and if any amount of it hadn't been collected, that's added to a new $100 booking fee. I think we're really shooting ourselves in the foot by charging it. It makes a fairly minimal impact on the overall budget for the jail. It's a $52 million budget we heard today, and we're looking at collecting roughly $400,000. It's not nothing, but again, when I think our top priority should be getting people back on their feet, it's a small fiscal impact that, in my view, stands in the way of our larger goals of reducing the number of people who find themselves in a recurring situation of coming back into the jail. So my proposal is to permanently remove this booking fee and to waive the fee that is on anyone who it hasn't been yet collected but is still sitting in collection. But again, I welcome others' view on the matter, so I'll open it up for further questions, comments from board members.
Well, Mr. Chairman, what about the prospect of holding that money for the inmate and applying it to costs and fines and restitution at the end of their case, and then if they are acquitted, to return that money to them? Would that be more practical? Because at the end of the case, they're burdened with certain costs, fines, and possibly restitution. And not that $100 is going to go far, but at least it's something.
So, Your Honor, what you're suggesting is that the fee stay there, it stay due, but that it can be considered to be waived depending on the outcome of their case? Am I?
Correct.
If I may,
Yeah,
Chairman.
Mr. Resnick.
The money, Your Honor, that is collected for this fee is taken from the cash that an inmate comes into the prison with, and then any money that's deposited on their inmate account. We wouldn't have to take the money, we would just leave it on their account, and they would leave the jail with that money that was deposited on their account. They could, of course, use that for other things, but they could definitely use it to pay their fines, costs, and fees. And then the jail would have to be in the process of, an accounting process to keep track of this money, apply it. I don't know if the jail has the staff or the ability to do that.
Yeah, I think what I'm hearing, it creates, further sort of administrative burden to try to sort that out and to potentially waive it depending on case outcomes. And look, I'll also say that the booking fee that occurs at George W. Hill is really just one of many costs that incarcerated individuals face. The fees associated with their, with the going through, defending themselves, the imposition of fines and costs with regard to, the actual case itself, this $100 fee is only piled on top of that.
I do not agree with suspending the booking fee. I understand your argument, and I appreciate the support to the inmates. However, I'm going to align it with a healthcare argument. Someone doesn't ask to get a disease or actively get a disease and then have to pay a lot of money in medical costs, drugs, et cetera. We can have a social debate on whether someone asked to be imprisoned or not, and we won't. But for those reasons, I think we should maintain the booking fee to at least potentially have the person not want to return and not have an additional fee, as well as all the other social things that go along with being imprisoned. But I would not support it.
Ms. Levy, I want to make sure I understand your point. So you're saying that folks would be more inclined to not care about being incarcerated driven by a $100 fee, that they may actually want to go to jail if they're not being charged the $100 fee?
No, I'm sorry if I misspoke and that was the interpretation. I'm not sure that a $100 booking fee should be waived because your argument is to help prevent a return to the prison and having additional charges on and on again. To find out if that's true, is the recidivism rate so much that their $100 is now $500 or $600 or $700? I'm not sure that someone just chooses to go to jail. They are charged with a crime. To support Judge Whalen, if we could support, if they are not ultimately found guilty, that their money go back to them. I do like that idea quite a bit, but I'm not sure the $100 is going to prevent recidivism, which is what I think you're saying. And I'm saying I think we need to recoup costs for caring for the individuals who are incarcerated.
What I'm saying is that not that the $100 fee is exclusively going to keep someone from recidivating or coming back to jail. But my point is that a $400,000 a year revenue source on a $52 million prison budget is fairly de minimis. But for someone who, with a population that leans toward indigence, right? These are folks who weren't able to meet bail, not exclusively, but many are there because they weren't able to post bail. A $100 fee can be quite significant for them. And when they're trying to get their feet back under them, having fees and expenses that hang over their heads does truly have an impact on their ability to get their feet under them and live a productive life. So I think I would look at it more as a fairly small investment where I agree with you, it's hard to sort of point specifically at how many people will not recidivate because of the waiving or because of the suspension of booking fees, but it's worth the effort, right? When we are talking about a massive part of our budget, the largest singular budget item that we face, $50 million a year, which is roughly 30 cents of every real estate tax dollar that we collect going toward incarceration, a relatively minimal investment that may reduce our prison population, looking solely from a fiscal perspective, is a wise investment. Not to mention the fact that it's, from a human perspective, is giving people a chance to get their feet back under them.
I'd like to make a comment as well, if I could, please.
Yes,
It
Your Honor.
appears to me that, thank you very much. It appears to me that 40% of the assessed administrative fee is not being collected. It remains uncollected. So therefore, the individuals who cannot pay the fee are in fact not paying the fee. So that group of individuals are already protected. But I want to talk about the other greater than 60% of the prison population and what I see coming from the prison. To my view, the greatest number of cases that come now are for violations of the Uniform Firearms Act. That means that these are offenders with guns. They possess illegal, dangerous firearms, or they are not permitted to possess firearms for enumerated reasons. They possess guns, they display guns, and also at times use them in the commission of a crime. I don't have to explain the devastation guns cause. You can read that in the news every single day. There's a constant cry from the public to do something about guns. Pennsylvania has strict gun laws and they are enforced. The gun violators possess not only extremely dangerous firearms, but very expensive guns. Some will outfit their guns with extended magazines so that they can cause destruction with not just 10 bullets, but with 50 bullets in one gun. Perhaps the members of the board have never had to look into the faces of victims of gun crimes as they beg for justice, or worse, the families of murdered victims. The pain, the anguish of soul, the frustration, and their heartbreak overwhelms them. They question why, for what reason. The senseless violence that robbed them of their loved ones has no answer. It leaves them changed people for the rest of their lives. Members of the board, do something about guns. It would be unwise to give gun offenders another break. They can pay the $100. Next, most often the cases I see from the prison are people who are charged with possession with the intent to deliver. This means pushing and selling illegal controlled substances, and the drugs I see emerging as more and more frequently being sold is fentanyl. Fentanyl is what is killing the children of Delaware County citizens. It is highly addictive, 50 times stronger than heroin and 100 times stronger than morphine. And the people who are selling this poison to your kids couldn't care less about your loved one, whether they get sick, overdose, or die. Greed drives them. Money drives them. It's not unusual when an arrest is made of a drug dealer, the police will also confiscate large sums of cash. Members of the board, they can easily afford the small sum of $100, and it would be unwise to give drug dealers another break. Next, most often I see robberies, burglaries, and thefts. These offenders are motivated by greed. I could also say a lot here, but I think you understand how terrible these violent crimes are. Think of the victims. They feel so violated, so vulnerable, and will suffer from PTSD for the rest of their lives. Members of the board, do not give these offenders another break. Next, I see assaults. Assaults on spouses or significant others. That's more prevalent than assaults on strangers. The assault most emergent on spouses or significant others is strangulation. Do not support this offense by giving abusers another break. The next crime I see most unfortunate are crimes against children. Two kinds. One, sexual assaults on children. They are not committed by people who are marginalized, but by selfish people who put their gratification above anyone else's. Damage they do to young lives is incalculable, and to their families that experience overwhelming guilt. The next kind is sexual abuse of children by downloading and viewing child pornography. I don't need to say more about this horror. Do not give sexual offenders another break. They easily can pay their small contribution. Also, it is clear the County Council does indeed believe in people chipping in toward their expense. All county employees who are very modestly paid have received notice that they must now pay toward their health insurance costs. It would be grossly incongruent to ask employees who give so much to the county and its citizens to contribute to their expense while at the same time relieving those who wreak havoc on the same citizens of their responsibility to pay the same. Lastly, I would suggest that before making your decision, you find out for yourself who is in the prison. You don't have to accept my observations, but neither should you accept someone else's prejudgment as to who is. Also, before making your decision, it may be wise to speak to victims of violent crime for their perspective on their survival. It's a question of fairness. Thank you very much.
Thank you, Your Honor. I would like to say a couple things in response. you have rattled off a number of crimes that I don't think anyone on this board would like to be, lenient upon. We're not talking about being lenient upon violent criminals, people who are dealing opioids or robberies. We're talking about, first of all, a population that I believe it's at least 80% of folks who are in the jail are there because they couldn't post bail or because they violated parole or probation. They're not there because they're, convicted murderers. This is a population that's essentially there because they, if I could, I didn't, I'm sorry, Your Honor, if I could just, I did not interrupt your comments, and I'd appreciate the same.
And I appreciate that very much, but I don't think that you should continue to make overly broad generalizations and irresponsible conclusions when you don't know it. You don't know who's out there, and they can afford it. They can afford it. And let me also say, while I'm saying something, that Warden Williams, to her credit, said just today that she knows that they have a responsibility to county dollars. This is a responsibility to county dollars. Number two, that booking fee is important. And number three, Ms. Phillips said we have to look for revenue. This is revenue. We found it. This is important. It needs to stay. Thank you.
Your Honor, with all due respect, you are making generalizations when you rattle off the crimes that you yourself seem to experience most often in your courts. That doesn't reflect the realities of the population that we have. And I'm happy to provide to members of the board statistics on the actual prison population and the very high percentage that are not there because they're convicted gun offenders or drug dealers, but are there because they violated probation or parole or failed to post a relatively modest bail number. This is not,
well, then,
and again,
you make
Your Honor, I'm
decision,
sorry, if I would appreciate that you not interrupt. I did not interrupt you, and for the second time I did interrupt you. I'd appreciate if you not interrupt me. This, again, if you want to look at it purely from a fiscal perspective, and we want to reduce the $50 million a year burden that incarceration places upon the taxpayer, the best way to do that is to safely reduce the prison population. And when you have people who are incarcerated purely because they don't have the economic means to post bail, to have adequate defense, or to post the fees and expenses that this county places upon them, we are making an unwise fiscal investment by trying to receive what's $400,000 a year when it's impacting a $52 million budget that could be reduced if we safely reduce our prison population by not having people incarcerated who are there purely because they don't have the fiscal means, the economic means to stay out of jail. So again, I am fine with viewing this from a cold-hearted, black and white tax dollars perspective. But if you want to take that perspective, I think it's short-sighted to purely look at one side of the equation, which is the $400,000 that we're accepting in booking fees, and miss the fact that the much larger driver is a reduction of the prison population.
Chairman Madden, you said that 2 years ago when we stopped the booking fee. Your whole argument was this was going to reduce the recidivism at the prisons. It did not. But I will tell you what will reduce recidivism at the prison, because I've been doing this a long time, and that is people accepting personal responsibility. I have read literally thousands of drug and alcohol reports, pre-sentence investigations, and the people want to accept personal responsibility. They want to change their lives when they get out of prison. It's accepting personal responsibility. Part of that responsibility is paying for your own upkeep. And they're not paying for their own upkeep. This is a small fee, and I think it's important. Your recidivism argument you made 2 years ago, and it proved to be incorrect.
Your Honor, I will point out that our prison population today at 1329 is roughly, quick math, in the range of 35 to 40% lower than it was 2 years ago. And so prison population has been reduced. Now, it's hard to point to singularly what pieces of what have been done have had the biggest impact, but the prison population is going down, and consequently, it is saving taxpayer money. Now, I think your perspective on fairness, I can't argue with. If you want to view it from a, you know, should we be penalizing people more or less than we currently are? I get that, but I do find it very hard to imagine that people are going to go out and commit more crimes because they don't have to pay $100 when they get booked at jail. That just, to me, defies, like, sensibility that that's going to happen.
I'm not making that argument. Maybe you want to say that I'm making that argument, but I'm not making that argument. I am making the argument that these people are financially able to pay that $100 booking fee. The ones that aren't paying it. They're not paying it. It's not collected. Nobody goes after them. It's not paid. The people that can pay it will pay it. And it is a matter of fairness. It's also a matter of personal responsibility, and it's also a matter of not coddling these people. I think it's important.
I understand your perspective, Your Honor. We obviously disagree, and I do not think if you were to take a tour, and I'm sure you have, you walk through George W. Hill, I don't think you see 1,300 people who are being coddled. I would welcome if there are any other perspectives from board members.
Chairman, I have a couple comments, if you can hear me.
Yes, we can.
I just want to, I agree with some of what you say, and I agree with some of what Judge Brennan says, and I disagree with some. I do think that $400,000 is a substantial amount, even though the budget of the prison is great. I do see that as a substantial amount, but I also can view it as an investment in the people that are incarcerated and getting them out on their feet. I don't think we want to create debtor prisons, and I do think that there is an abundance of fees that come with, finding yourself in the judicial system, on the wrong end, and some people, as you noted, they will be there because they've been arrested, but they can't make bail and they have not been found guilty, and they may, be acquitted. So, but I do think the $400,000 is a lot, but it could be an investment in the people. I disagree with Judge Brennan. I don't believe that booking fees are a weapon against crime. I don't think that really has a bearing on that. It just becomes another extraneous fee that gets added to someone's bill as they go through the system. Frankly, I would count on the jail sentences that criminals.
Controller Phillips, it seems like you've frozen. Actually, it looks like everyone's frozen. Sean, is it on our end? It looks like. I'm not sure if the public can hear us, but if so, we're having some technical difficulties.
I think that we do want to safely reduce the prison population, but I just don't see this booking fee as being a key component of any crime fighting or deterrent.
Controller?
And I just think that it becomes another fee, and I do think it hangs over people's head as they get out and have to make their way in the world. So, I support a reduction in this, but I do think it's got to be seen as just an investment in getting people on their feet that are primarily indigent. And I don't disagree with the judge that some criminals can certainly pay the $100, but they have other things to pay, like fines and forfeitures and restitution, and then jail time. That's the way they're going to pay, and that's the way it will deter crime. So when they're arrested and found guilty. So that's my position.
Controller, I hate to say it, but there was a freezing of the.
How much do they actually pay in court costs on the dollar and in restitution? You're aware, aren't you?
Ms. Phillips, you're on mute.
Yeah, I'm sorry, I'm on mute. I mean, I'm not personally, I don't have the numbers in front of me, but I've read the memo regarding the fees, and I know there are fees with every filing and every time you touch some part of the judicial system. And I know, and I believe that there are fines and there's forfeitures and there's restitution that they should pay, and that's where the money should go for the people that are found guilty.
Controller, you did freeze in the midst of your remarks. I think we got the gist of what you said, and Zoom has a way of sort of catching up, so I think we heard it. But just so you know, there was a bit of a freeze there. I
Okay.
just want to make sure we hear from folks who we haven't yet heard from. Sheriff Sanders, were you about to speak?
I just want to echo Controller Phillips' position. I agree with Controller Phillips.
The only thing I would add to it is the fact that I don't see it preventing people from committing crime, nor do I see it reducing recidivism. I'd be interested if there was a study out there that somehow could be evaluated to determine how a minor fee, and I think we all agree that this is a minor fee. No one's suggesting that it's a significant fee. But if it's a minor fee, I don't think it's preventing crime. And if it's a minor fee, I don't see how it's preventing recidivism either way. I do have concerns of, as Controller Phillips says, to eliminate over $400,000 from the budget. And I think the link between the employees, and we hear it on the third floor, between the employees, the court employees, and having to contribute to their health care is, if county council has to continue to make up these deficits for us eliminating line items from the budget, it's money that could be spent, presumably, or utilized, other county council money utilized in benefiting employees. I would be happy even if the $400,000 was used to benefit correctional staff and complement them with their salaries. But I don't also see at this point in time, I'm not saying in the future, but at this point in time, unless someone could demonstrate recidivism reduction, and I'm all for recidivism reduction, unless someone can demonstrate.
Unless someone can show a demonstrable reduction in recidivism, and then you kind of cut out.
Well, that's just it. I mean, unless you can, and I understand what you're saying, and it's all, what your philosophy is certainly solid. And if we could reduce recidivism, we certainly could reduce the cost of the prison, which benefits all the residents of Delaware County and would have a tremendous effect. However, I don't see waiving a booking fee of $100 as an ability to reduce recidivism. I agree with most of what was said in different areas that, for example, it's such a minor fee, and I agree with the controller, but we also have to make up that $400,000. And I would, and these are very difficult times. I mean, the employees have been telling us with some of the increase in costs, with the rate of inflation of 8%, they're struggling. And as Judge Brennan indicated, they don't make a lot of money in the county. They didn't come here to make a lot of money, but at the same time, they're struggling and suffering. And I would hate to eliminate line items where the burden is going to be put back either on the taxpayer or it's going to be taken from another line item that could benefit something else. That's all. But if we had a study that said it would reduce recidivism, I probably would be all for reducing the cost in the prison.
I would like to come around to a couple of things you said, but I also want to give others a chance to talk who haven't yet. Other remarks from board members? Well, if not, then I do want to respond to a few things you said, Your Honor. And I have a lot of sympathy for the desire to have hard studies that would show the impact it would have on recidivism. But I think that cuts both ways, right? We also don't have studies that show that the booking fee in any way does not impact recidivism. And so if we were starting from a place, which we essentially are over the last 2 years where there hasn't been a booking fee, the idea that imposing a booking fee and doing so, would that not reduce recidivism on Zoom? The only other thing I wanted to mention to what you said, Judge Whalen, is the idea that $100 isn't a lot of money. I think that's probably the case for all of us here on the board. But given the fact that the $100 is not paid off by many and cuts into what they would have available to them for commissary, indicates that this is a significant amount of money for a lot of them. If it weren't, they would want to have money available to them and through commissary, and it's not the case. So you are dealing with a prison population that, on average, has been unable to post bails that range in the neighborhood of $2,500. These are folks that would be able to stay out of jail if they could post something as relatively minimal as $2,500. So when you're talking about a population of that sort, $100 is a relatively meaningful amount of money.
And I'm sure this is for a conversation in another day. However,
Yes, sir.
we need to look at that issue because when I was the district attorney, I had people out at the prison that would waive cases where they just couldn't post bail. And if it was a nonviolent crime, we would stipulate to reduce bail to ROR, which means release on your own recognizance to get them out of jail. I don't know if that's being done. I've been out of there now for just about 5 years. But there are programs at the prison to make sure people that are indigent, and the only reason they're in prison is because they can't post bail. If it's a nonviolent crime, I'm sure DA Soltheimer would work to try to get those individuals out, provided that they're safely vetted, that they're not a danger to the community. So that should be looked at some point, but it's for a different day, a different time.
I totally agree with you, but I do think that the issues are in some respect aligned, but you're right, that is also a significant one. We haven't heard from a few other members of the board. I don't know if your thoughts positively or negatively about the booking fees. They would be certainly welcomed.
Thank you, and I think I share kind of the mixed concerns that Controller Phillips has. You know, fees are established to offset the cost of providing a service. So I don't think you can treat them as general revenue. They have to, otherwise they become taxes or fines. So I think booking fees should, if they are in place, need to be applied towards the cost of what we're trying to offset. I find the relationship between the employee benefits cost and the booking fees to be a little disingenuous, to be honest. But I won't go into that any further either. I think the point here, though, is municipal governments, local governments waive fees for various reasons. I have a little bit of an aversion to looking at a booking fee as a revenue stream and a profit center as well, so that I'm inclined to agree that the fees should at least be reduced, because if we're way out of line with everyone else in the Commonwealth, then I think there's a morality issue tied to that, and I would support reducing and looking at the fee structure. Even though one of my primary jobs is to balance the books for the county every year, I think sometimes you do not, but you have to offset that with a compassionate look at what you're doing. So in that regard, those are the reasons I would put forward for being in support of reducing and looking at the fees.
Yeah, I know on my end, you know, I have mixed thoughts on both sides as well. You know, in a perfect world, it'd be nice to see where any fees that are collected go into the inmate welfare fund that in return assists them. You know, one of the things hearing that when people are arrested and incarcerated and caught with, you know, large amounts of money for, you know, violating things in our community, that something is, you know, financial is taken from them and invested into prison for other inmates long term. Like when we were talking about things like the exercise equipment and different, you know, when individuals, when we do the commissary bags or the holiday bags and different things like that, something that benefits the population, that goes back to the actual population that is in George W. Hill. You know, just seeing it on that end, I wish, you know, if revenue was to be collected, you know, something that when we talk about $400,000 and just programming and different resources and how far that can go in other areas instead of just sitting in that, you know, that big pile that we talked about. So, you know, I would love that whatever direction this goes into, like if that was ever an option where the booking fees continued, whether they were reduced or not, but where the revenue was utilized to actually, you know, go into that inmate welfare fund where it's giving back to the inmates. So it's an opportunity where it's not just something being taken from and put in a general fund, but something that is enhancing the experience and the, you know, benefits of the inmates that are at George W. Hill. That's kind of, you know, the side that, you know, one of the mindsets that, you know, I was kind of thinking of.
Mr. Corson, I appreciate the thought. I just want to unbundle that a little bit. I guess if you're taking this fee from inmates and then it goes right back into their pockets in the form of enhancements to the inmates' welfare. I don't know that I understand necessarily what the rationale would be of having the fee in the first place.
I mean, I
You're
guess-
essentially creating something that's administratively burdensome that only at the end of the day isn't really creating the penalization that I hear a few members of the board arguing for. It's not doing anything from the perspective of the general fund. It's not, it actually would continue to sort of, all of it would be lost from the balancing of the budget. So I don't want to sound like I'm disparaging the idea at all. I just want to make sure I understand kind of the thought process
No,
there.
absolutely. No, and if I didn't communicate it appropriately, I guess, one of the things I'm not on the budget side of things, right? So I'm up here on the jail oversight board to better improve our county jail. And I guess what I was coming from was if 100% of the fees were being paid, then I kind of understood that. But I guess what I was looking at was if 40% of the individuals can pay this, and out of some of them, if they're individuals that are coming in with, money that, may have been, collected, in criminal activities, that 60% of indigenous population that can't pay the fees receive something. That's what I was saying. So, I mean, if it was 100%, like you said, just a fair mix, pay a $100 fee and then receiving something. But I did know that there was a large population of people that couldn't even pay the $100. So I was just saying the individuals that can pay it, if something could go towards the whole population. And again, it was just my thoughts on it, just something to kind of put out there of anything that can enhance or better. I know there's sometimes that the warden has to come in here with different presentations. And I know, if there's different funds that can assist in that, that it could be beneficial. But that was just kind of a another perspective on the situation.
I appreciate that. Look, I think in the interest of trying to find a center of gravity for the board, what I'm hearing is a general receptivity to the idea of reducing the fee, that there is desire to reduce the financial burden placed upon inmates and perhaps provide some measure of help to their ability once leaving jail to get their feet back under them. But perhaps that there is a majority that still likes the idea of there being some form of penalty placed upon them in a financial sense for their burden on the system of going into jail. Now, while I think I've been clear I would eliminate it completely, I want to be respectful of what the center of gravity is on this jail. And so I wanted to sort of informally poll the board members if we were to perhaps consider cutting it in half and moving it toward the average for the state, which is $50. Sort of a quick yay or nay on that from board members? Is that something that there would be interest in?
I have a question. Is that average of 50 for state-run prisons or all prisons, or
That's for county jails
for county jails? Okay.
like us. So it would put us in line with the average of the county, and I believe roughly Montgomery County charges 60, but the average is 50 across the Commonwealth.
Well, I think my opinion would be 100, but on the sake of getting some penalty, because this isn't a charm school, they're not there because they're paying tuition, I could agree with $50.
Thank you, Ms. Love.
Mr. Chair, I think I would agree with going more towards what the state average is, but I don't know that that's the end of the discussion long-term, because I still would like to better understand what the benefits of charging it are. So, yeah, one of Mr. Resnick's responsibilities is to give us the basis to make data-informed decisions, and I'd respect what he would further bring forward, but I think immediately I'd support reducing it to the state average.
So that would be support for doing it immediate, with the understanding that none of this is set in stone and has to be viewed as permanent. And perhaps, I heard a number of board members say, I wish there was more data here. perhaps this allows for us to gather more information, understand how the reduction is impacting, and how, $50 as a fee is continuing to burden folks.
I know on my end, Mr. Chairman, is if, for me, I was looking at it that if this is something, being taken from the inmates, something that benefits them. So as far as I'm concerned, if it's still being set aside in the same way in the general fund, it would be, the same difference for me as if it was, $50 or if we, voted to, suspend it completely. But I'm completely open to supporting, reducing it and then continuing to have discussions moving forward.
Okay. Thank you, Mr. Corson. Folks that are on Zoom, I hope you can still hear us.
Yeah.
I can.
This is Joanna. I would support a reduction. I have to be honest, when we voted for this initially, I thought that we went high on this amount and that it doesn't really relate to, it doesn't seem to relate to some administrative cost that we even know what it relates to. What are we offsetting exactly? So, I mean, I would support reducing it, but I do think maybe in the future with some more data, I would also support eliminating this because I think there are other places to collect fines and have people pay their penalty. So, but I would support a reduction of it now.
Thank you, Controller.
Well, Mr. Chairman, I would support for the short term, reducing it, long term, eliminating it. I believe it's a line item that never should have been a line item any more than assessing a portion of the utility bill to people that come into the correction system.
Thank you, Sheriff. I'm not sure if there's anyone else who would like to opine on the $50 reduction.
Well, I support
can
what Ed
support-
Love
I'm
said. I
sorry.
guess what Ed said is, I wish it was kept the same, but we'll, accept if the majority of the board want to reduce it in half and go from a little more than $400 to a little more than $200,000 in that line item and have county council make up the difference, then so be it.
Well, inherently, to be clear, county council would be making up the difference regardless. It's one
No,
line
the
item in a fungible general fund balance. And again, with more evidence, I would hope to be able to show that reducing prison population ultimately is a saver than it would be the loss of direct costs associated with this.
Well, if you show me that, I'll second the motion.
Understood.
I can support that.
All right. Unless there's anyone else who'd like to discuss this, I would entertain a motion to reduce the booking fee from $100 to $50 going forward.
I'll make that motion.
I'll second it.
We have a motion and a second, and I also just want to get any clarification, if there's any clarifying questions from the warden or others as to what we'd be proposing here, anything that you'd need clarification from the board about.
Thank you for that opportunity. We want to make sure that we're executing this in the manner that the board believes is consistent. When would this be effective? And those that currently have a $100 fee associated because they were booked within the time period, would we be reducing that to $50 or maintaining that as part of their collection?
Is it administratively reasonable to reduce from 100 to 50? Does that create problems that we're not really thinking about?
Well, if it's an effective date going into the future, it could be effective tomorrow, then that's no problem. But the past, we would have to go back individually to every person.
To answer your question directly, we could do it. It will be an administrative burden.
Okay, so I would suggest that we do it prospectively, that it's effective today, and that any new bookings coming in the door are booked at $50 fees.
May I
I
request
support
that we
that.
start tomorrow?
That's
Okay.
fine by me. So effective October
12th?
12th.
That was the only clarification that I required, unless there's something else I'm missing. Thank
Further
you.
thoughts from board members on that clarification or anything else associated with this item?
It's like when the motion is made, it's made with the understanding that we will continue this discussion in the future.
Thank you, Sheriff. Hearing none, all in favor of the motion on the table?
Aye.
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 Any opposed? I hear no opposition. The motion passes. All right, thank you all. The next item is the Deputy Warden's reports.
So I will have, or I will ask, not have, Sean to queue up that report for us. And I will invite Deputy Warden Daley Falley and likely Program Administrator Kelly Shaw to the podium. Thank you.
Thank you, Warden. So many of you don't know, or some of you guys do know, that I used to live in Massachusetts for 25 years, and before I transitioned to DC. And one of the things I did in Massachusetts, we did a lot in Massachusetts through the Department of Public Health under Commissioner Auerbach and Commissioner Monica Burrell, is before we invest into anything, we do our research and we conduct focus group and all that. I'm saying this because 3 months ago, when I did a presentation, we did a presentation regarding George W. Hill about the population, what type of program and services that we should bring to the facility. I met with my team and we thought that we should do substance use program, like activities and all that. But then I asked my team to go to our every single housing unit and do a research, do a town hall, take a survey, and see what exactly the population are saying. So I did it, and I put the result on our previous meeting, and I believe they surveyed 374 people, and the top 3 activities and services that they wanted, one was workforce development, 2 was more leisure activity, and 3 substance use programs. Great. Sean, can you help me with this? Thank you. So I'm not going to go through every single slide. I'm just going to skip. I know that we're running out of time. But here are some highlights for the month of September. We had 4 individuals that graduated with a GED. That brings us to 24. And we really want to enhance and focus on our workforce development as that was a need from our population. So 21 Flagler for certificate received, so that makes a total of 41. We also resumed in-service religious services. That was a need and asked for before. And thank you to Reverend Dunn for provided in-service IP around religious services while we're waiting for our volunteer class to start on November 12th. And also, we also resume anger management. We really want to focus on the result of the survey we conducted back in June, and we expanded our workforce development. Thank you, Dan Doers, to implement the Spartan Chemical program, which is a training program to provide certification for our IP population when they get out of facility that are OSHA compliance. We also, because this is a voting season, we work closely with the Women's League of Voters of Delaware County and the Delaware County Election Board for training and development on voting. So so our incarcerated population will have opportunity to register to vote and to vote as well. We expanded our reentry services to Honest Child, in which Ms. Shaw will talk more about it in her report. And then as of today, we have 75 incarcerated persons who are verified on Bureau of Foreign programs. As we said earlier, our population is decreasing. And ever since we opened the door, and I want to thank every single members of our county government, the public defender office has been working closely with us, the district attorney. Thank you to the case manager, Director Ruth, and his team to identify individuals who can leave early, and also program people to refer them to inpatient programs as well. As you can see, the last quarters, our intake and discharge have been pretty much the same except for September. As many people, we take in 557, we release 583. So our team has been very actively to work with the population to make sure that they do what they're supposed to do in order to be released from our facility. Case management services has been providing double duty. Remember, it's the population was in the 1,300. They conduct over 2,500 services of case management for each population. I'm not going to go too much into the academy. My team has been working very hard, and 4 more individuals received their GED. But I want to focus on the workforce development, the expansion of it. As I say, Spartan Chemical offers a program that trains employees on keeping facility clean and compliant. The Clean Check training module covers topics for cleaning in areas such as restroom, hard floor, carpet. Safety modules ensure that OSHA compliance trainings in bloodborne pathogen meets their standards. And currently, we have 14 incarcerated persons that graduated and have their certificate. And this is how this certification looks like. So once they graduate, Dandor and Ms. Kruski will give that certification, and Ms. Kruski will mail it to their resident so they can have it when they get released. WellPath services. WellPath has been busy this month. They conducted 140 COVID tests for the month of September. 563 at peak got vaccinated, which comes up to 43.8% of the populated vaccination. There are 75 confirmed Suboxone program, and they hired a MAT patient wellness coordinator for the CSOSA grant, and we're looking forward to work with her. We're going to provide not just mental health services, but we want to combine mental and wellness so they can receive their treatment and have some wellnesses through their therapy. For the month of July and August, WellPath provided for July 3,983 services, for August 5,706, and for September 5,354. As you can tell, the majority of their services is through detoxes. We have a very high substance use disorder population. 20% of their visits are sick call when they go to every single housing unit to provide sick call. And the third highest is psychological visit. We have a very high mental health population. Our medication decreased, thank God, but our mental health population increased. So I want to spend some time on our substance use services. As we are planning on enhancing our substance use services, it's important to see who are our population. So during this quarter, there was 272 individuals that received some form of substance use services, right? 68% was male, 12 were female. I'm sorry, 32 was female. I can do the math today. 35% was African American, 61 were white, and 3% was Hispanic. The age range, the majority is between 26 and 35. The second highest is 36 and 45. Our geriatric population is increasing, so we're really trying to look at that as well. Even though they are at 9%, we really want to make sure that as the geriatric population increases, we identify services to them. Now, the most important thing, what are the drug of choices? As you guys can tell, and we mentioned it earlier, 57% of it is all about opioid, fentanyl, and heroin. It is an issue in Delaware County. The second is meth. Increase in meth. We heard it from the judge earlier, and Mr. Corse is shaking his head, yes, that is so true. But only 11% is alcohol, and 12% is cocaine. So what we're trying to do right now is we need to know who is our population. So remember, I come from a school of public health in Massachusetts, so we have to do, I would say, see who's our population, what type of service can we provide to them. Thank you, Ms. O'Connor, for putting this data together. It's really appreciated. Our Narcan distribution increased. Thank you for our intake and discharge team. Now we're going to focus on grievances. Thank you. So during this quarter, 12% of our population in July, 13% of our population in August, and only 11% filed for grievance. And most of the grievance, only 63 of them were filed in favor, 64 in August, and 70 in September. And when I say filed in favor, it means that like they had a reason to grieve, and we were able to resolve it. The majority of the grievances there were 711 grievances that were submitted. Out of 711, only 505 were grievable. The reason they were just grievable, there was 107 were error, and several of them were duplicates. The majority of the defense was staff conduct. And number two was more about commissary. And now we finally hired a commissary manager through Airmark, and she will be overseeing the commissary challenges that we're facing at George W. Hill. And the third highest is healthcare services and access to healthcare and all. And religious services, we're very fortunate the last 2 now we didn't have any death. Now that we resume in-person religious services, thank you to Reverend Dunn, we see a lot of incarcerated population who are interested or focusing on their religious faith. November 12th will be our orientation for faith-based organization who would like to provide services. Please reach out to Reverend Dunn so she can register you for the training on November 12th. And any question before I have Ms. Shaw talk about reentry services? I'm sorry I'm speeding. I understand we're running out of time, and I don't want to be between you guys and dinner, so.
Questions thus far from Williams? Go ahead, Deputy Warden.
Okay, Ms. Shaw.
Thank you, Deputy Warden Fowley. Good evening, members of the board. I'm just going to present some reentry service quarterly highlights. We implemented on August 23rd the Inside Out Prison Exchange Program through our partnership with Penn State University Brandywine, and participants will have the opportunity to earn college credits at Philadelphia Community College. Pathway Home 3 grant partnership with Delaware County Workforce Development Board and EDSI will provide job readiness, job search skills, employment goals, education and training, and wraparound support. We hope to start in late October. Cohorts will service 10 to 12 incarcerated learners for 4 weeks, and then we'll meet one-on-one with career specialists. And just this afternoon, our grant officer approved our program flyer, so we'll begin promoting the program this week. The Pell Grant Experiment Partnership with Delaware Community College, we continue to meet with them monthly to provide program-specific needs to our population, and we expect to start January 2023. Some other reentry service highlights. For the quarter, all sentenced incarcerated persons accepted reentry services to include an individualized packet of resources. We have added Honest Job application to the tablet. Honest Jobs is the nation's second chance employment website. It has job postings from over 800 companies. And when incarcerated persons can begin their search at the facility, and they continue upon release. Users will have login credentials that do not expire. For our recidivism rate, so far this year, our recidivism rate is at 62%, and that's rate on average in the past 2 years. Drug and alcohol mental health liaisons. The liaisons are an extension of probation and parole who work on site at the facility. And this month we had 19 more drug and alcohol releases for a total of 97. Our ViaPath Services quarterly review. Effective August 15th, the facility increased to a 1-to-1 tablet ratio. Electronic LexisNexis legal search engine is now available to the population on the tablet, which extends our services of the law library. A Devo platform is available to the population via the tablet, which includes vocational, educational, and life skill courses. Effective September 1st, this facility no longer accepts personal mail and money orders. All personal mail is received digitally, and we encourage friends and family to deposit money online, as it is a quicker process to receive the money online. And lastly, for wellness, juveniles are continued to be offered a wellness class 4 days a week. Wellness plans and exercise demonstrations are offered to the general population on a weekly basis, and board games and basketballs are replenished quarterly. This month, our wellness instructor will focus his efforts on the MAT participants. Thank you.
All right, thank you, Deputy Wardens. Any questions from board members? Comments? Hearing none. Any updates from subcommittees? If not, we will move on to the last round of public comments. Is there anyone from the public who wishes to address the Jail Oversight Board? Hearing none. Any last board member comments before we adjourn? So ready to call this a night. If not, I will entertain a motion to adjourn.
Motion.
We have a
Second.
motion. Motion a second. All in favor?
Aye.
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 Any
Aye.
opposed? We are adjourned. Thank you all.
Thank you.
Thank you.